Hi, I'm Dr. Mark Stengler, and in this video I'm going to talk about how does stress affect cancer. Now, when speaking to patients about the time preceding their cancer diagnosis, many state they had intense, prolonged periods of mental or emotional stress. Now, health experts are certainly in agreement. The effects of uncontrolled stress can certainly be deadly. According to Dr. Lorenzo Cohen, professor of general oncology and behavioral science and director of the integrative medicine program at MD Anderson, he states, quote, "Stress has a profound impact on how your body's system function. Stress makes your body more hospitable to cancer," end quote. Many studies have been demonstrating this connection. For example, the results of 165 studies indicate that stress-related psychosocial factors are associated with higher cancer incidence in initially healthy populations. As well, there was poor survival in patients diagnosed with cancer in 330 studies, and higher cancer mortality was seen in 53 studies. In general, our bodies adapt well to short-term stress. However, chronic levels of high stress causes the brain to release hormonal messengers that stimulate our adrenal glands, which are our master stress glands, to release hormones such as cortisol and epinephrine, known as adrenaline. So long-term exposure of our cells to these stress hormones causes the following. Stress hormones increase the production of free radicals, which leads to DNA damage and impaired immune function. Stress hormones increase inflammation through the production of inflammatory proteins known as cytokines, which also impair immune function and promote cancer growth. Stress hormones directly impair immune cell function. As well, stress hormones reduce the ability of abnormal cells to undergo cell death and DNA repair. These are important self-regulating anti-cancer mechanisms. Stress hormones also stimulate the production of insulin-like growth factor 1, vascular endothelial growth factor, and other growth factors that can promote tumor cell growth. As you can see, if you or a loved one is battling with cancer or you have a history of cancer, it's imperative to incorporate a stress reduction program as best you can. For example, exercise. A review of the effect of lifestyle factors on breast cancer mortality found that physical activity has the most pronounced effect of all the lifestyle factors on reducing breast cancer recurrence. Physical activity can reduce breast cancer mortality by about 40%. Other great stress fighters include prayer, humor and laughter, and getting professional counseling. For cutting-edge information on natural and holistic treatments on a wide variety of healthcare topics, and to get my newsletters, visit healthrevelations.com. And if you want information on my private clinic, then go to markstengler.com.